Hello and welcome to this session, which is part of a series of videos for Nutrition Matters for the early years, and the training is provided by Public Health Dietitians Group Northern Ireland. My name is Fiona and I'm a health improvement dietitian in the Southeastern Health and Social Care Trust. This training is part of your pre-training videos and it should be watched before the live sessions. So you do have to attend the live sessions in order to get your certificate at the end of training. This is a short video on food safety. So food safety, you will appreciate, is really important whenever you're caring for under fives. So the areas where food is served, where it's stored, prepared, should be safe, clean and hygienic. And extra care really is needed for babies and young children, as they can have a lower resistance to food poisoning than we would have as adults. So the first thing I'm going to look at is hand washing. So you're probably very well aware that hand washing is really important. So hands should be washed with warm soap and water, and that's your hands and the children's hands. And that should be before or after handling any food. You also want to wash your hands after touching bins or pets, changing nappies or going to the toilet. And looking at food safety, we talk about the 4 C's of food safety. So the first C I'm going to look at is cleaning. So you should make sure that you clean down all surfaces, utensils and touch points with warm soapy water before and after preparing food and in between preparing raw and cooked foods. You should also keep your kitchen clean and tidy. The next C then is avoiding cross-contamination. So if we think about our chopping boards there, so we've got some examples on the screen. So you would want to make sure that you don't use the knife that you've just used on raw meat to then chop salad vegetables that aren't going to be cooked, because that would transfer bacteria onto your food there and potentially cause food poisoning. So you'd want to be using a different knife, or if it's the same knife, you want to be washing it in between. And it's probably a good idea to be using separate chopping boards there to avoid the risk of cross-contamination. Our next C then is chilling. So we want to make sure that our fridges are at 5 degrees Celsius or less, and our freezer should be at -18. If you've bought food from a shop and it needs to be put into a freezer or a fridge, what we would say is get that food in immediately into your fridge or your freezer. Don't leave it sitting out on the worktops where it's going to become warmer. So make sure you get it into your fridge or your freezer as soon as possible. The next C is cooking. So make sure that you are cooking all foods really thoroughly, cooked the whole way through. Make sure they're piping hot. That also applies to any food that's being reheated. Make sure it's cooked really thoroughly. If you're reheating foods, they should only be reheated once. You can't reheat them more than once. Looking at the storage of our foods in terms of our food safety. So if we think about our fridge, so there's a picture on the slide there of a fridge. You'll see there that the raw meats are at the bottom of the fridge, and then our cooked ready to eat foods are on the upper shelves. That's really, if you think about your raw meats, you don't want any juices or blood or even bits of raw food dropping down onto something that you're going to eat without cooking, because that's going to potentially cause food poisoning. So just be really mindful about how you store your food in the fridge. Looking at our use by dates then, so make sure whenever you're buying food for your childcare facility that you check the use by dates, and you want to use any food that's got a use by date. It needs to be used up within that date. So if we take the example on the slide, there's a food there that has the date of the 18th of June. And what we want to do there is make sure that by the end of the 18th of June, that food has been used. That's because the risk of food poisoning is higher if you were to take something after the use by date. So you don't want to eat anything after its use by date, and that's in terms of food safety. You might wonder about best before dates then. So best before dates are really there in terms of the quality of food. So you can actually eat something after the best before date. It is just that it won't be as good a quality as if you'd eaten it within the best before date. So that's where the difference is between those 2 dates that you find on foods, your use by and your best before. So the important thing to remember is use by definitely needs to be used within its use by date, because that's trying to reduce down the risk of food poisoning. If you've got pets, so this probably applies if you're a childminder, you should keep your pets and their feeding bowls out of the kitchen. Looking at milk safety then, so if we take breast milk first, so breast milk should be stored in the fridge. It can actually be stored for up to 8 days in the fridge at 4 degrees Celsius or lower. If your fridge is higher than 4 degrees Celsius, so you remember back that fridges need to be at less than 5 degrees, 5 degrees or less is your fridge temperature. So if you've got a fridge that's higher than 4 degrees, then any breast milk within it needs to be used within 3 days. Breast milk that's been cooled in the fridge can be carried in a cool bag with ice packs for up to 24 hours. And it can be served straight from the fridge, or it can be heated in a jug of warm water or under a warm tap. But you shouldn't reheat breast milk in a microwave. If you're using formula milk then, so if you're reheating, or if you are, making up freshly prepared formula milk, then it should be freshly prepared for each feed. You should be using sterilized bottles. They should be made with boiled water that's been boiled to above 70 degrees Celsius, then cooled quickly to room temperature, used up straight away, and throw away any milk that's not being used up. If the formula milk can't be made up fresh in your childcare facility, you could ask parents to bring in cartons of ready to feed formulas. So there's an example on the screen there of what that would look like. Or if parents are choosing to make up formulas at home, then the feed should be made up and cooled in the fridge for at least 1 hour before being transported to your childcare facility. The feed needs to be labelled and transported in a cool bag with an ice pack, and on arrival you should be transferring that immediately into the fridge. It can then be used within up to 24 hours. You should note though that if the feeds are not cooled in the fridge, or if they've been transported without an ice pack, then they must be used within 2 hours. Just looking within food safety at choking hazards. So children under the age of 5 shouldn't have any whole nuts. They should also avoid popcorn because of the risk of choking. And you're probably very familiar with small foods being sliced lengthways. So that's foods such as pieces of sausage, cherry tomatoes, or grapes. So make sure they're sliced lengthways. If you're looking for more information about food safety, so looking for good quality evidence-based practical advice about food safety, then we would really recommend checking out the food safety information that's on the Safe Food website. So Safe Food are an all-island organisation here, and they have lots of good information about lots of different topics, which is hopefully really relevant and useful for yourselves. So we will look forward to seeing you at the live sessions of Nutrition Matters for the early years, and the topics that we'll cover are on the screen there. And just a reminder that you should watch the other 3 videos in this series before coming to the training. So the other 3 video titles are on the screen there. And do remember to make sure you've booked your place with the Childcare Partnership before you come to training. But we'll look forward to seeing you there. And thanks very much for taking the time to watch this video. Bye-bye.